Hello, everyone. Childhood obesity is one of the most serious public health challenges of the 21st century. The problem is global and is steadily affecting many low and middle income countries, particularly in the urban settings. The prevalence has increased at an alarming rate. Globally, in 2010, the number of overweight children under the age of 5 was estimated to be over 42 million, and close to 35 million of this were living in developing countries. Overweight and obese children are likely to stay obese into adulthood and more likely to develop non-communicable diseases like diabetes and cardiovascular diseases at a younger age. Today on the show, we're looking at obesity in children, and my guest for today's show is Dr. Puddicombe. Please welcome to the program.
Thank you for having me on the show.
All right. Dr. Puddicombe, I read in the newspaper some time back that parents actually find it difficult to see that their children are overweight. It's like they sort of block it out. It's like they see their children as, my child is fine, he's chubby and he's nice. What do you have to say about that?
Well, in this environment, we've learned to associate chubbiness, let me use your word, as a sign of affluence.
African setting, yes.
So we see somebody, he gets married, talking about adults, and we expect him to come out with a pot belly in a very short time. If he's not doing that, his mother-in-law, his mother is harassing his wife that she's not doing her work very well. But what can happen in that situation you mentioned is that parents may find themselves comparing their children with other children who may not necessarily be at their ideal weight. They may actually be overweight. Okay. And as such, when a child who sadly may be at the normal weight is not looking as big as his or her contemporaries, there's a tendency to be encouraged to eat more. But actually, what happens is children have opportunities to actually have their weights assessed at regular intervals. The least interval should be actually during the well child visits. Okay. Usually in this environment, we tend to do that more when they come for immunizations. All right. So ideally, any child that comes for immunizations should have his weight checked, because even though we are talking about overweight and obesity here right now, undernutrition is still a major issue. Okay. And it's very common among children less than 5 too. Okay. So as we are looking for children that are not getting to their ideal weight, it's also an opportunity for healthcare providers, people attending to children, to actually identify children that are overweight.
Dr. Puddicombe, what of a case where the mother, like I said, is not able to see that the child is overweight? When you see that there's a problem, then there's a tendency for you to look for a solution to that problem. But in a situation where the mother cannot see that the child is overweight, I have an example of someone who is close to me who had about a child that was 1 year old, and the child was weighing 20 kilograms. At this point, the child was not able to walk. The child couldn't crawl, but this was a mom who told me that I was not feeding my child well because my child was not as big and as chubby, and my child had, at the age of 8 months, was walking. Hers was still crawling at 1 year. And so in that case, when a mom is not able to see and the mom is not able to, maybe go to the doctor to say, I think there's something I need to do, my child is overweight, what can anyone do in that kind of situation?
Well, thanks for that question. What happens, especially in child health, is that there are numerous opportunities for a child to actually come in contact with the healthcare provider in this environment, usually during the periods of immunization. So in that mother's case, I want to believe the child would have gotten his full complement of immunizations and would have had numerous visits to a healthcare practitioner. Maybe the person that saw the child did not really recognize or did not point it out to the mother.
It's possible for a mom not to agree that the child is overweight.
What can also happen is that the mother may find herself having to compare her child's weight with the weight of other contemporaries.
Okay. Doctor's orders today is ensure your child has 1 hour of exercise per day. If you have a son, let him play football outside with his friends. If you have a daughter, let her, play hopscotch and all those things we used to do when we were children. Thank you so much for being a part of this program today, and we expect to see you next week. Take care. Bye.